Good morning, everyone. We're here for Wellness Wednesday, where I interview various wellness practitioners, experts in their fields, to share tips and tricks on how to live better, how to have a better lifestyle, how to be healthier, and so we're going to dive right in today with Dr. Chelsea Rackham. So Dr. Chelsea Rackham, she is a chiropractor, but not just your ordinary chiropractor. I shared her bio, and she has a history with sports chiropractic, right? And now she really focuses on women's health. Is that right?
It is. It's quite the blend of things I have going on.
Yeah, no, it's great. And so she is based in Dallas. And so if you live in the Dallas area, she is there on hand. But she also can be found on her website and through social media channels as well. And I think after today, you'll want to connect with her and learn a little bit more from her. So welcome, Chelsea.
Thank you. Thanks for having me.
Yes. So let's dive right in. So you're a doctor of chiropractor, but you do more than adjustments. Is that right?
I do. So my chiropractic side is even, it kind of veers off the traditional chiropractic route because coming from the sports world, I've worked with a lot of athletic injuries that respond really well to really specific soft tissue work and functional rehabilitation. So my chiropractic side has a lot of soft tissue and adjustments as well. So it's a bit of a hybrid. But the majority of my practice for the past 3 years or so has been in functional medicine, specifically geared towards women. So all of my postgraduate education is learning about how to assess the body as a whole and how all of the parts work together and finding the root causes of symptoms. So when women come into my practice, the first appointment, we spend an hour and I just basically listen to her talk and tell me her story and tell me all the things that she's been experiencing. And that way we can get a big picture of her health. And then I run comprehensive blood work, again, showing kind of how the whole body is working together instead of when you go to your conventional doctor for blood work, it's really segmented and they only run a couple things. And there just really isn't a lot of information that you can glean from that. It's not complete. So I run comprehensive blood work, and then we go over that and I explain how everything is working and how that relates and causes their symptoms. And then we create an individualized lifestyle treatment plan from there. So it's definitely a natural approach. Everything that I use is really high grade supplementation, but we're also talking about things like mindset and sleep hygiene and obviously moving your body, and nutrition is a huge portion as well.
Definitely. And I feel like that's so needed with women because we are very complex, where men do not have as much going on as women from the hormone standpoint, and that impacts everything. So I think it's so important to have a comprehensive approach because doctors traditionally do a quick fix and they don't do a full panel like you said. And so you don't always know, you get a maybe it could be this or it could be this, but you don't actually have that root cause. So I love that. So
yes,
you have a really unique way to approach health and teach your patients how to be an active participant in their own health, right? And so how did you come up with that, and I guess dive right into what it is and how to incorporate it?
Yeah, for sure. Well, so kind of a backstory about how I got started. I started my practice in the spring of 2016, so coming up on 4 years now. And 3 months later, we found out that we were having a baby. And it wasn't planned, it was unexpected. And I didn't expect to basically have 2 babies at one time, my practice and my human baby. So after she was born, everything totally changed. I never thought that I would be somebody who wanted to stay home and kind of just focus on being a mom. But once I had her, a lot of stuff came to the surface for me. I have led a very strange life, and after my daughter was born, it kind of triggered some things that were unresolved from my past, and So I was having a lot of emotional things going on, and I had PTSD on top of my postpartum depression and postpartum anxiety. So I was dealing with a lot emotionally. And then I was dealing with a lot physically. I was having like, God, I just felt like crap all the time. And I think a lot of moms can relate to this. I was just so tired. I was so fatigued. Obviously, you're not getting sleep. Even, making sure that you're eating enough is difficult because you're just always taking care of another human. So I was really struggling after my daughter was born. And I lost my identity. And for that first year, well, for the first 6 months, I was kind of just like wallowing in it. And for the second 6 months and the 6 months after that, I was like, I need to make a change. And my husband is a chiropractor as well, and he specializes in functional neurology. So what he does is he rehabs traumatic brain injuries and concussions and really anything that's wrong with your brain, he's like excellent at. So he has that whole thing covered. Plus he has a functional medicine background too. So with our joint brain power, we started kind of coming up with a plan to help me. I started reading books and podcasts and I started working through my past issues, and we got me on a nutritional plan and a supplement plan, and we were doing some neurological work as well. So we were approaching this from really a multi-pronged approach. We had the neurological side, the brain, the physiological side, the body, and then the psychological side, the mind. So we came up with this, because of that, we came up with this, this method, and we call it the spherical health model. And basically it includes all of those parts. And it's a really great educational tool to use in our practice, because if we were in person, I would draw it up on a whiteboard, but basically you can visualize it as a Venn diagram of all those, having those 3 circles, and they meet in the middle. And total wellness is in the center of all of those things. So this spherical health model is really important for our patients because it helps them understand that health is not just, is your body working or is your body not working? Health is, how is your brain working, and is that affecting anything else? How is your body working on a cellular and chemical level, and is that affecting anything else? How's your psychology working, and how is that affecting everything else? And everything really feeds into each other. And the reason that's so important is because if we want to find the root cause, if our goal is to truly get people well, we have to pull out all of the contributing factors in each of those categories. And whether we need to bring in other providers, or whether we need to, for me, I pull in a lot of mindset stuff just because my education is in the physiology, but my street smarts and my street cred and my life experience is in the psychology. So I bring a lot of that in because I know how important that is, especially for women, especially for mothers, and they're not getting it anywhere else.
Yeah. I love that. I love that it's all 3 connected. And when they come to see you, it's not, oh, a quick fix, let's do an adjustment, or let's do this, or let's do that. So I love that.
Yeah, for sure.
And you're really looking at the person and all components of that person and where they're at. So awesome. So those that are not members in your practice, how can they, utilize their own health sphere to create this total wellness?
Yeah, so one of my grand visions is to kind of bring this to the public, and again, kind of help people understand that I just want to change the landscape of how health is talked about, because conventionally health is so linear and so mechanical, and it's just like, well, this little thing isn't working, or you have this symptom, so let's just put a band-aid on that and then you should be good. But if we hit an iceberg being the root cause, and we just are kind of patching up the smaller holes, eventually the ship is still going to sink. So
right.
My goal is to bring this idea to the public and the community and help people understand that you can kind of fill in, because you're an expert of your health, right? No doctor, no other person in the world is going to be able to complete this health sphere as well as you can. So I want to, if you follow me on Facebook, if you follow me on Instagram, in the coming days and weeks and months, I'm going to be talking a lot about how to kind of create your own health sphere, fill in the gaps, and how to use that to find providers that can really help you and kind of understand how all of it works and relates together as well. So basically, my point is follow me on social media, because I have some content and some programs coming up that I want to help teach this.
Yeah, I love it. And I think that, so often we've just been raised that, oh, we just deal with it, or, oh, it's just something I'm always going to have. I have it. And I have even seen through essential oils and really through people looking for holistic alternatives that can be solved, that can be reversed, it can be supported. And we're not meant to live in a state of pain or, anguish of any sort. We are able to control our health and really make shifts for better. So I love, love, love this. So, well, thank you so much. Is there anything else that you want to add before we wrap up?
I don't think so at the moment.
Awesome. Well, that is it for today. Thank you so much for being our guest, Dr. Rackham.
Yeah, thanks for having me.
Yeah. Okay, bye everyone. Have a wonderful Wednesday.
Bye.